Why did Qatar enforce COVID quarantine rules for Asian countries? Vaccinated travelers from 6 Asian countries need to quarantine for 2 or 10 days depending on where the vaccine was taken. Doha, Qatar. Qatar's decision to enforce mandatory quarantine for vaccinated travelers coming from 6 Asian countries was a result of an increased number of positive cases among those arrivals, health authorities have told Al Jazeera. Starting from August 2, all vaccinated travelers from India, Pakistan, Bangladesh, Nepal, Sri Lanka and the Philippines are subjected to a 2-day hotel quarantine if they received an approved vaccine in Qatar or 10 days if vaccinated elsewhere, the Ministry of Public Health, MoPH, announced on July 29. The announcement, and different requirements based on where the vaccine was received, caused outrage on social media, with people questioning the need to quarantine for additional days despite getting the same vaccine. Ministry of Public Health updates on travel and return policies to the state of Qatar. The Ministry of Public Health has announced the following updates regarding the travel and return policy for COVID-19, effective midday on Monday, August 2, 2021. Authorities said the enforcement was put in place due to the risk posed by individual countries, which is risk posed by individual countries. Qatar has reported more than 227,000 cases of the coronavirus since the start of the pandemic, including 601 deaths. Earlier this month, officials confirmed they had detected the Delta variant of COVID-19 in the country. It has administered more than 3.9 million doses of COVID vaccines since the start of the campaign this year. In response to the latest global data and the number of arrivals at Qatar's ports of entry, Qatar's travel and return policy has been updated to ensure the safety of travelers and the safety of the population, Dr. Abdul Latif Al-Khal, chair of the National Health Strategic Group on COVID-19, told Al Jazeera. This includes reinstating a short period of quarantine for travelers from Bangladesh, India, Nepal, Pakistan, Philippines, and Sri Lanka. With large numbers of people returning to Qatar from these countries, we are seeing an increased number of positivity among these travelers. In July, Qatar announced it would resume issuing family and tourist entry visas for vaccinated and recovered cases. However, travelers were left questioning the need to quarantine for longer, and end up paying as much as 8,505 Qatari riyals, $2,330, if they had received the same vaccine from outside Qatar. I understand these new rules are to safeguard Qatar citizens and residents. Please consider to reduce hotel quarantine to 2 days for residents who have taken 2 doses of Covishield in India. As we will have 1 negative RT-PCR before travel and 1 negative RT-PCR on 2 day of quarantine. Lokesh Reddy, at Lokikothur, July 31, 2021. At WHO, it is the benefit of vaccine if all the countries are not accept the own vaccine. 1 vaccine take from Qatar, 2 days quarantine, and same vaccine take from Pakistan, 10 days quarantine. What is this behavior? Vaccine but from another country? This rules seem arbitrary and senseless. Al-Khal, who is also head of infectious diseases at Hamad Medical Corporation, told Al Jazeera that the decision was taken as authorities were only able to verify vaccinations done in Qatar. A record of all citizens and residents vaccinated in Qatar is stored on a national database, he said. The Ministry of Public Health cannot yet verify all vaccination certificates from abroad, and therefore a different set of measures remain in place. Earlier this month, Qatar decided to continue with Phase 3 of its gradual lifting of COVID-19 restrictions following a rise in reported cases, although minor updates with some relaxation of the rules were announced a few days later. A statement from the MoPH said it will continue to monitor key performance indicators to ensure a balance between the continuity of providing protection to the population on the one hand and restoring social and economic life to normal, on the other hand. The slight increase in COVID-19 cases was expected following the Eid holiday and with greater numbers of travelers returning to Qatar, Al-Khal added.